She's going to be sharing, and Dr. Higginbotham, you can explain your topic much better than I can, but I know it has to do with dementia. It has to do with proteomics, right?
Yes.
Then we're going to hear from Dr. Ken Hepburn. He's going to be sharing caregiver tips, and that's just it in a nutshell. Followed by Dr. Hepburn, you're going to hear from Cynthia Haley Dunn. She's going to be giving us an update about the Atlanta Regional Commission resources. And then you're going to hear from Whit Morgan. What do we talk about every week? Our healthy aging study, because we are a research center and our ultimate goal is to find a cure for Alzheimer's. All right, so Dr. Higginbotham, I have made you a co-host, so take it away.
All right, great. Hopefully you can hear me, and I'm just gonna share my screen. Are you able to see my screen, Cornelia? Okay.
Yes.
Okay, great. I'll put it in presenter mode. All right. So thanks for Cornelia for the introduction. As she said, I'm Lenora Higginbotham. I am one of the physicians over in the Movement Disorders Department at the Emory Brain Health Center. And I was asked to talk to you a little bit about my research today, which is in the field of proteomics. And basically, this is the detailed study of proteins. And so today I'm going to talk to you about what the proteome can teach us about dementia. So when you hear the word protein, I don't know about you, but maybe the first thing that comes to mind most times is like a big piece of meat or some sort of food. But really, foods are made up of proteins, just like your body. And when you blow them up, they're not like pieces of meat. They're these microscopic molecules that look kind of like this on the side here, this picture, on this colorful picture on the right. And proteins, these microscopic molecules, play a key role in virtually every process within the cells of your body. The human body, believe it or not, is comprised of approximately 25,000 different proteins, so quite a few proteins, and about 30 to 50% of these proteins can actually be found within brain tissue. So your brain tissue is comprised of thousands and thousands of proteins. But interestingly, when it comes to dementia, particularly Alzheimer's disease, we tend to only talk about one or two proteins. And right now, most of our dementias are currently defined by abnormalities in either just one or two hallmark proteins. So when it comes to Alzheimer's disease, you may hear a lot about amyloid, which is a protein that accumulates in plaques in your brain, or tau, which also accumulates in amyloid. Or dementia with Lewy bodies. If you're someone familiar with that, you may have heard of alpha-synuclein, which is another protein that accumulates in the brains of these Lewy body patients. But the story is actually a little bit more complicated beyond one or two proteins. So just to put it in perspective, the brain of the average demented elderly person often contains hundreds of abnormally altered protein levels. Okay, we know this now. And then most individuals with Alzheimer's disease have overlapping hallmark protein abnormalities typically associated with other dementias. That means if you have amyloid accumulating abnormally in your brain, there's also a high likelihood you might have some alpha-synuclein in there or some other type of protein that's accumulating abnormally that's usually associated with another dementia. So that makes the picture complicated too. And then even within the Alzheimer's community and among our patients, these proteins that are changing abnormally in this disease could look different in you than from, say, another Alzheimer's disease patient. Because say, outside of amyloid, which everyone has, or tau, which all the Alzheimer's patients have, but these other proteins, you might change in a different way in magnitude and degree than somebody else with a diagnosis of Alzheimer's disease. And so this is a paper that was published recently, and I'm just going to break it down for you. But basically, it's just to show the complexity, right? So stands for Alzheimer's disease. This stands for dementia with Lewy bodies or Lewy body dementia. This is another dementia you may have heard of called frontotemporal dementia. And this down here is vascular disease. And what this is trying to show is right directly across from the dementia, right directly across, or in a big, thick arrow, the same color as the name, is the hallmark protein that it's associated with. So Alzheimer's disease is associated with A beta, which is amyloid, and tau, right? And Lewy body dementia, like I said, associated with alpha-synuclein, and so on and so forth, right? But then you see all these dotted arrows here. Those are all the things that the average Alzheimer's disease brain could also have, in addition to A, beta, and tau. So if you take the typical Alzheimer's disease brain, you see this blue mark here, about over 40% also have alpha-synuclein accumulation abnormally, right? And then down here, this green one, about maybe 40%-ish also have this other abnormal protein called TDP43 accumulation. And so it gets very complicated, right? They all overlap to some degree. And why is this so complicated? Well, our genetic material, our DNA, which I have a little picture over here, also makes up your entire body, and it contains the code for producing proteins, right? But there are a lot of things that affect how much or how little of the protein your genes make or your DNA makes. The biggest one probably is age. So as you age, this just basically changes your protein makeup, and your DNA will make will definitely change in the amount of types of proteins it makes. Genetics, so your genetic makeup, whether you have mutations or things like that, can also affect what proteins your DNA makes. Your environment, this can include anything from just like exposures to lifestyle habits. We've seen that education can actually have an impact on dementia, right? And so all these things can influence your protein makeup. And then comorbidities, so whether you have diabetes or high blood pressure or anything else, can also really impact the proteins that your body makes. And why does this matter? Well, this matters because for several reasons, but it definitely matters in healthcare, right? Because we definitely can focus on one or two proteins, which is great because we know that those proteins are intimately involved in these dementias. Like amyloid, we definitely know plays a role, tau plays a role, right? But what are we missing with all these other proteins that we're not as well defined? Well, we might be missing ways of detecting patients earlier. We might be missing ways of better profiling them for clinical trials or better predicting their prognosis. Or disease monitoring, right? But the biggest one is this thing called precision medicine. Perhaps when we treat one person with one drug, they may not respond like the other person simply because they have different proteins that are changing, et cetera, all these other ancillary proteins. And one thing that precision medicine and moving into that kind of category entails is just defining all these things that are abnormal and basically knowing them in detail enough so that we can individualize treatments when they arise. So proteomics, what we do, how this all ties in, is just a means of analyzing thousands of proteins within a single biological sample. So proteomics is the opposite of paying attention to one protein. It is paying attention to thousands at one time. And how this works is we just get a brain sample, a tissue sample. We can get CSF, we can get blood. We run it through something called a mass spectrometer machine, and we don't have to run that much, tiny bit. And we can measure all the proteins, or not, I shouldn't say all, but a large number of proteins in that particular sample. We can do all kinds of things, look for proteins that are expressed similarly, look for proteins that have similar functions in disease that may be altered in disease. But the main thing is we can get like a global picture of disease-related proteins in a sample. And so Emory actually has a pretty big multidisciplinary proteomics lab, which I'm a part of. You can see me here. It's mainly run by Dr. Alan Levy, who some of you may have met or be patients of, and then as well as Dr. Nicholas Seafried, who's a PhD in the biochemistry and neurology departments. And I'm not going to go into detail about all this, but over the last basically decade, we have come a long way in how we can conduct proteomics. Our methods are more sensitive. We can detect greater numbers of proteomics in the sample. We've done a lot with the Alzheimer's disease brain. And one thing we've gotten really good at with the Alzheimer's disease brain is just characterizing all these different proteins, that these hundreds of proteins that are abnormal, and finding which ones are more consistently abnormal, which ones might be good to pay more attention to in the CSF or spinal fluid or blood. And what we've learned is like I was talking about, like all those proteins, we've learned various things about the proteome. We've realized that there are proteins involved in inflammation, in myelination, this like sheath that covers your nerves, in RNA binding and splicing, all these different functions, right, that are increased in Alzheimer's disease. And you have some of the more common ones down here, these different networks. And then we have all these things, all these proteins that are involved in synaptic function, which is like the junction between your nerves and all the signaling, and mitochondrial, which are energy centers of your neurons. And all these things that are decreased in Alzheimer's disease. And we've pretty much profiled these pretty extensively. And now what I've been doing with the lab is we're starting to look into spinal fluid and blood. And one thing we're at least finding in spinal fluid is a lot of these changes are reflected in the spinal fluid proteome as well. And one of the biggest, I think, kind of steps we made for in the last year is like identifying in the spinal fluid these different panels of proteins that would be good to pay attention to and basically move towards assay development. We have a long way, but we found very promising proteins that can really help profile an individual person in Alzheimer's disease better than maybe just focusing on one or two. And we can actually look at different functions and see which ones are most abnormal. And how that might help is maybe one day we have a drug that targets maybe more vascular changes or something. We could look at your vascular profile and see, like what proteins are changing or if they're changing, and personalize that medicine for you. This is down the road, but this is what we're trying to get to. And so, like I said, we hope this will lead to more comprehensive markers of disease and personalized medicine. We are still in the lab. We are working towards assay developments for all these proteins that we are finding. One of the biggest things, very recent news, is that Emory established a new Brain Health Personalized Medicine Institute. Now, it is not a building that you can frequent right now, okay? But it is a step in the right direction. It is like putting a team of people and a team of minds and building this group that can bring some of these ideas and changes and this big data, what we call it, this big proteomic data, but also other omics data, and bring it into the clinic so that we can really change it into something that really highlights the individual brain and allows us to treat you as well as possible. And so that's all I have to say. And thank you for listening.
Thank you so much, Dr. Higginbotham. So just a quick follow-up. You talked about CSF. So let's just break that down for our audience and why, people will see a brain and say, oh, I have to be dead, or you're going to biopsy my brain. But no, there are other mechanisms to access.
Yes, I'm so glad you asked that because I meant to talk about that. But yes, the key from moving from the brain into things like the spinal fluid and blood is because the brain is not very accessible, right? These are all brain tissues of people who have been involved in research studies, and then after they are deceased and they gave us permission to analyze their brains, we take some brain tissue and look at what is changing. And we do that because that's where the ground zero of the disease is. That's where it's happening. We want to make sure we know what the ground zero entails. But to make markers that we can use clinically, we need to move into more accessible samples. And that would be spinal fluid, which we can get from a lumbar puncture, which some of you maybe had, but the holy grail is probably blood, right? So that would be even easier to obtain while patients are living. And so we do a lot of that now, and we are analyzing. We're basically moving from the brain into the CSF and blood in the hopes of, making a clinical transition.
Excellent. And so you are conducting a research, correct?
Yes.
And are you still recruiting mild cognitive impairment?
Yes.
Cognitively impaired?
Yeah, sorry. Yes. So I actually am on the movement disorders division, and I probably should have made a slide for that, but I basically am looking more at Lewy body dementia. Okay, but I am a part of the same study, the memory study, that is also in the Alzheimer's Disease Research Center. So that particular study is recruiting, but you probably would go more through the cognitive department for that. But if you're a Lewy body patient, definitely I am interested in you. So perhaps maybe I can share some contact information for my research coordinator or something with you, Cornelia, but I don't have a slide for that, but we're
Okay, yeah, if you want
recruiting
to,
like
if you want to
all
put it
people. I'm specifically
right.
recruiting Lewy body, but then we have other people recruiting Alzheimer's disease, mild cognitive impairment, all of the above.
Excellent. So if you want to drop that contact information in the chat or send it to me via email, and I will send it out over email to all of our viewers and everyone who has registered for a session here.
Yeah.
Okay, well, that was such an excellent presentation. Thank you so much. You explained, now we know if you hear proteomics, I think everyone online right now could explain it. And if you can't, I'm going to send you a PDF of Dr. Higginbotham's PowerPoint presentation, as well as a link to today's video. So you can sort of recap and regroup and share the information and take a little bit more time to digest everything that she shared with us today. All right, so now you're going to hear from Dr. Hepburn. He's going to be talking about caregiver tips and strategies that you as a caregiver can employ as you are transitioning to our now active normal stage as people are becoming more vaccinated, and definitely as individuals are going out into the public and masks are not being required. We just want to give you some tips. So hello, Dr. Hepburn, welcome.
Hey, Cornelia, how are you and how's everybody?
I am well. I have made you co-host so you can share your slides.
Well, thank you. Love Dr. Higginbotham's talk, and I will not have a final exam after mine, so there's no continuing education credit, but I hope this proves to be somewhat useful. So I've just been struck, as I suspect many of you have, at over the last couple of weeks, it feels as though the last 20 months didn't happen, right? You walk around, everybody's walking around, nobody seems to be wearing a mask. I mean, I'm waiting for people to just kind of arbitrarily rub up against each other, and it's amazing to me. So I've entitled this, okay, it's over. No, it's not. But so how does one think about sort of going through the world, especially if you happen to be a person who is guiding a person who's living with a dementia illness? How do you go through the world? Well, the first thing is get vaccinated for sure. If you're not vaccinated, both of you should be vaccinated. And if you are, you know, that's a very strong protection. It offers very strong protection to you and to the person, both from contracting and from transmitting the virus to others. So there's there really is a great comfort in that and a great sense of safety. So that means also that you can feel safe as much as life is safe with others who are vaccinated. And I'll kind of get to that in a moment. One caveat, one thing to remember is that kids under 12, for the most part, aren't yet vaccinated. The vaccines aren't tested and demonstrated to be effective in those kids. So they are at risk. And I think that becomes particularly important in family gatherings and maybe in other kinds of gatherings as well. So it isn't so much that you are going to get a virus from them or going to give them, but their chances of contracting the virus are higher than yours. And so that ought to enter into people's planning for family events and things like that. So most things outside are really okay, provided that there's enough space and no big groups crowded together. So I simply would never, under any circumstances, go to a Braves game. I wouldn't go to a large gathering where there's people sitting very, very close together, whose main form of hydration might be alcohol, and therefore a disinhibition. Um, it just would make me feel, and I'm not that, terrified of things, but that would make me pretty uncomfortable. But a walk in the park or just around the block, that's a great thing to do on almost under any circumstance. I probably advise doing it in the mornings these days. I would say if you haven't explored the Atlanta Beltline, do so, except for that stretch from Piedmont Park down to Krog Street, which is about as crowded as Brave Stadium. But it's a lovely walk. Most of it is paved, and it's really kind of sparsely populated. You can drive there, get out, do a little to and from walk for as long as you want. Lots of fun. Outdoor concerts with limited attendance. I gave a talk like this the other day, and someone said, "Oh, the botanical garden is offering some concerts in the park. They're limiting attendance to, I don't know, 50 people." It's an enormous lawn. You can put 50 people and be, barely see one another. So spaces like that, events like that would be really, I would feel very safe. Outdoor religious services. My wife and I walked the dog the other day, and we walked past a church that said Sunday services every other Sunday outdoors. So they're going to be spaced apart. People will be outdoors. Um, seemed, seemed like a really reasonable and good idea. I would not hesitate to go and have an ice cream or a coffee or something, sit outside on a bench and, sort of combine a walk with a treat. And think about that kind of an outing with the person. It could be a whole afternoon's outing, a whole morning's outing, even going to someplace, getting a donut, coming outside and eating it outside. Certainly a picnic with family and friends, even with little kids. And that's just a short list. I'm counting on you to put other examples in the chat box of things that you have done or would feel comfortable doing outdoors. So you can share that with, we can share that with one another here. And I think there are some things indoors that are just fine too. We've had people to dinner in our house inside with the doors closed, but we've all been vaccinated. So we've kind of expanded our pod. It's a small group, maybe 2 or 4 other people. And I think I felt a complete sense of comfort there. Closely controlled indoor events. So our church has a lottery system. They've just reopened. They're admitting 70 people for one service a week. Every other pew is sealed off. You have to have your temperature taken at the door. You've got to wear a mask, and sit 6 feet apart. And so, in that environment, as a person who's vaccinated, with a wife who's vaccinated, I have no hesitation. Concerts, plays, movies, where they are controlling the environment. I went to a movie. We went to a movie. Every other row was closed. And it turned out we were the only 2 people in the theater. But actually, we've gone to 2 movies, and the second time there were 4 other people in a giant theater. We are part of a theater. We were subscribed to a theater where they've sent us seating plans. The small theater seats 150. They said, if we said, we're only going to admit 70 and we're going to space people this far apart, would you come? And I said, sure, I would love to do that. We have gone to museums. Now, until a few weeks ago, you had to get a ticket to go into a museum. Now it's wide open. So I felt much more comfortable in some sense a couple of weeks ago when I knew there was a limit to the number of people. But even now, big spaces, I still feel okay. And would I travel by train or plane? Absolutely. I think that they're being really, really cautious on those transportation systems, and enforcing rules about still wearing masks on planes. I think that's fine. And then here's some iffy parts. So thank you to the CDC, which, you know, I think was a little over eager about the relenting, but the commercial world is back. And so if you go now to almost every store, it'll say if you're vaccinated, masks are optional. Now, I have no idea what that means, except I know I'm vaccinated, and I'm not. If I see somebody walking at me not wearing a mask, does that mean he's not vaccinated or he just doesn't care? Because there's still, you know, a very sizable portion of Georgia that is not vaccinated. So I think there's a lot of people walking around without masks who aren't vaccinated. So I want to make sure I'm not in a very tightly closed space with those people. So when I go to a mall, I did go to a mall. There really are lots and lots of people. I wouldn't, as I said, go to a sporting event where I feel really closed in with people. I wouldn't travel abroad just yet. I would want to know what each country requires, what the hot spots are, what the situation on the ground is like in those countries before I venture. As much as I would love to do the traveling, be very cautious. So I said, if it's enclosed and crowded, proceed with care, and it is not over. Know the local conditions, know where the hotspots are, and those are guidelines, not rules. And I think everyone is sort of has to interpret and internalize and think about that and make judgments on, you know, on your own. Yeah. So that's what I got.
Excellent. And again, it's your choice, right, to be vaccinated or not, but we are a science community and we believe in the science, and the science says, hey, the vaccine works.
Yeah. Okay.
All right. Okay, we are at 2:43. Thank you, Ken. What an excellent presentation. There are a couple of chats there if you will address those. We are going to turn it over to Mrs. Cynthia Haley Dunn with the Atlanta Regional Commission. Welcome. Thank you so much for being here with us again and returning and coming back to give us an update. So what do you have to share with us today?
Okay, I do have a PowerPoint which I can share, but I can do without. Actually, let me just give you an update without that. You may remember that I came some time ago, I guess about a month ago, and gave a presentation on the resources that are available through the Atlanta Regional Commission. And for anyone who missed that presentation, just to let you know that the Atlanta Regional Commission, the Aging and Independent Services section, is the area agency on aging for Metro Atlanta. There are 12 AAAs, or area agency on aging, in the state of Georgia. Here in the ADRC area for Atlanta, we call it the Empower Line, and that's at empowerline.org. It's 404-463-3333. We have a database of over 26,000 entries with services that are available, and we also have trained information specialists who are on hand to provide information. And that is available Monday through Friday from 9 to 5. But we also have a new feature now, in that our Empower Line feature has a self-service function. It's available 24 hours a day, 7 days a week. Again, just go to empowerline.org and you can look up resources for yourself. If, for example, you are looking for home delivered meals for someone, or homemaker assistance, or bathing and dressing help. We have a variety of services available, and in specific, you may be interested in respite care, and that provides some assistance to a caregiver who may, for example, just need a break to do other things, or perhaps you're going in for surgery and you need someone to take care of your loved one for a week or 2-week period while you recuperate. And for people who have loved ones who are in assisted living facilities or nursing homes, there is a long-term care ombudsman program, and they are trained to help to listen to the person who resides in the long-term care facility and to provide assistance with resolving any quality of life issues. And it can range from someone who's vegetarian and who isn't getting enough non-meat sources of nutrition to someone who feels that they're not being fully respected by the staff. LTCO or the Ombudsman program can help with that. We can also assist with things like transportation, helping you find state-funded services and also volunteer driver programs in the community. And home modification is another area where we do have an update. Recently, the Atlanta Regional Commission made grants available to a number of community organizations to help older adults make critical home repairs and also take care of home modifications. Often when someone lands in a hospital, the difference between being able to go back to your home or to have to look at a long-term care facility is the difference of having a home that is accessible and that is safe and a place where you can recuperate and continue to live independently. So we encourage you to look at programs like that. And I want to mention one other very important caregiver program, and that is adult day service. There are a number of adult day programs in the Atlanta area, and many have transportation services, where if a caregiver is working during the day, a loved one can actually be picked up by the service, taken to an assisted living, an adult day program for recreation and nutrition and intensive supervisory support. And then at the end of the day, they can return to their home and to their family where they're most comfortable. So we have a number of things for you to look at. Just give us a call at 404-463-3333. And you can also go to empowerline.org to learn more. And I do want to mention a couple of other programs. We have a special program called Powerful Tools for Caregivers. It's one of our evidence-based programs, and it provides caregivers with some strategies for being assertive, for learning how to pull together caregiving teams from among family and friends, and how to tap into the many formal and informal resources that are available in your community. Because we've learned that it's extremely important for a caregiver to have a full web of support. It's something that no one can do alone. And I also want to mention that again, if you're interested in caregiving outside of the Atlanta region, if you have someone that you're caring for who is not in Metro Atlanta, you can contact us and we can put you in touch with the Elder Care Locator. That's a service of HHS national service, which can put you in touch with any area agency on aging in the country. Now I want to mention some quick updates. I am with the AmeriCorps Seniors RSVP program, and this is a program in which we mobilize adults who are 55 and older to go out into the community and make presentations and to educate peers about a menu of topics that are important to living well and living independently. This Friday, in fact, we have our next presentation, which is on Zoom. It's called Managing Your Medications, and it talks about some strategies that people can use to have productive, effective conversations with their physicians and their pharmacists, and to make sure that they are aware of the pitfalls of overuse of opioids, for example, and how to manage medication storage and track medication usage in a way to do it as safely as possible. That will be this Friday, June 25th at 11 a.m. To find out more about that, go to empowerline.org and you can find the information on that event. We also have other programs on our presentation menu, and you can see those on empowerline.org. Very quickly, we have one on community resources for older adults and people with disabilities. We have one on screenings and vaccinations for good health, diabetes, loneliness, social isolation, and depression for older adults, disaster preparedness, and how to avoid financial exploitation. We are happy to make any of these presentations to faith communities or civic groups or senior living complexes, just any type of setting. Our volunteers can make these free presentations to you. And so if there are any other questions I can answer, please let me know. That was very quick. I don't want to take up too much of your time today.
Thank you so much. That was excellent. Lots of comments in the chat about getting the number. So I've posted the number, I've posted the web address, and that telephone number again is what, Ms. Haley Dunn?
I've written it right in the chat. It's
Okay.
404-463-3333.
And so what happens when people call that number? Can you just quickly tell people what they can expect when they dial that number?
Sure, you have a few options when you do make that call. You could call and ask for something very specific, such as I need someone to come in and provide veterinary service to my dog in my home. Or you could say, I'm not quite sure what I need. And what we do is we have a roughly 45-minute screening interview where we talk with you about resources and your history of falls, for example, what you are able to do, what your medical history is, and what types of needs you have that may be unmet. And we use that information and we run it through a scoring tool, and we actually use that information to recommend services that may help you continue to live independently in your home.
Okay, and then so they can just call. Is that intake online on telephone only?
That is a telephone intake, yes.
Okay, and it takes about 45 minutes, everyone. And so is there a income requirement, or is this an age limit? How do you sort of determine eligibility?
It depends on the program itself.
Okay.
Many of the programs are funded through the Older Americans Act, which serves adults who are 60 and older. However, we do have some programs such as work programs, which start at 55 years old for an eligibility age. And we also, many of the programs that that may be used to serve people who have Alzheimer's or other forms of dementia are open to any adult who have a form of dementia, regardless of age.
Okay, and now you mentioned several presentations, and I know we could dedicate a whole session, so we may have to have you come back in July with a colleague just to really hone in and focus on these resources. But individuals want to know, like, how can they set up a presentation with you to share information with their community?
They can just contact me by email, and I'll put that in the box.
Okay.
And
all right.
And I can take care of that for you. And we have some extremely experienced presenters on our Bureau of Volunteer Presenters. And of course, we staff people can come out and make presentations too. Right now, we are doing that via Zoom until further notice, but eventually we will start transitioning back to in-person presentations also.
Okay. All right. We are going to have you come back. And every time I ask Ms. Cynthia to come, she says yes. So I think as long as I give her enough notice, she's going to be available. Hopefully we can get her back before the end of July to just really walk us through what you can expect with the intake process, other services and resources. This is a statewide program. She's just representing the Atlanta Regional Commission. So as she prefaced in her comments earlier, there are how many other ADRCs or AAAs around the state?
There are 12 area agencies on aging around the state, and each one has an ADRC program.
Yes. All right. Okay. So 404-463-3333. All right. Thank you so much. We're going to turn it over to Whit to tell us about our healthy aging study, our healthy brain study. We're so glad to have you back here, Whit. Hello and welcome.
Much. Hello, everybody. For those that are joining us for the first time here, my name is Whit. I am the communication specialist for the Emory Healthy Aging Study and the Emory Healthy Brain Study. And I'd like to share my screen here because for those that haven't joined us, like I said, this is a really unique opportunity to get involved in research with a pretty low commitment. The Emory Healthy Aging Study is an online effort. What we're trying to do is essentially better understand how we age and what causes certain age-related diseases. And we're doing this by having our participants complete an online health history questionnaire once a year. And this is done actually through our website, which is why you're seeing our website pulled up on the screen here. But just kind of a quick overview of who's eligible for the study. This is actually open to anybody in the United States that is over the age of 18, can read and understand English, and has an internet capable device. It's really that simple. We do ask our participants complete that survey once a year. It takes most folks probably 25 to 30 minutes to complete. And it's going to ask you a series of different questions, such as just general demographics, as well as, current health. Do you have any ailments, diseases, anything like that? We also want to know about your habits, though. What is your lifestyle like? We start off these webinars each week with an exercise demo, and that's because we're big believers that what is good for your brain is good for your heart. Well, we want to know about that kind of stuff too in our questionnaire as well. So you'll see questions about how much exercise are you getting on a daily basis or a weekly basis? Are you eating your fruits and vegetables? If so, how much? Do you drink alcohol? Do you read books, play musical instruments, things of that nature? And all of this information year over year is painting a picture for us of certain causes to age-related diseases, one of those being Alzheimer's disease. And so I do want to touch briefly on our sub-study, the Emory Healthy Brain Study. That is an Alzheimer's focused sub-study. And what that is that's actually what we would call a biomarker project. It does involve coming into our clinic once every 2 years for sample and measurements. For things like that, we would do, for example, lumbar puncture is one of them. It's a very important sample that we do collect there. That cerebral spinal fluids, tells us a whole lot about really what's going on with our brains. But we also look at other things like cardiovascular health. We do some MRI scans, and we also do some cognitive testing. And that participation, as I mentioned, is once every 2 years, but it is a little bit more selective. We are looking for individuals between the ages of 50 and 75 who do not have mild cognitive impairment or any type of Alzheimer's disease or related dementias. We're looking for healthy individuals. And part of the way that we identify participants for that study is through the participation in the Emory Healthy Aging Study. So back to that main questionnaire here, and this is what I want to walk you through on our website because we try to make this really simple to get involved and to actually join the study. And when you're on our website here, that healthyaging.emory.edu, I'll also share this in the chat box here. When you click that join the study, we've broken it down into 4 steps because this is an online study. Everything is contained in our portal. That's how we keep data secure. It's also how we make it easy to get in and participate. So you would go through the registration process, the online consent as if you were participating in any other study. We get a little bit of contact information, and that number 4 right there, that health history, that's the actual questionnaire. It's a very easy research study to get involved with. And one of the things that, we're really trying to shoot for is to get 100,000 participants. So far, we've had a little over 30,000 people registered. So if this is something you might be interested in, I highly encourage you to, at least visit our website. I'll drop my email in the chat box as well if you want to ask me some personal questions about this. And I'd also encourage you, if you have participated, to share it with somebody. Word of mouth is a really important thing here. And it's a great way just to get others involved that may not know about this opportunity or may not have joined us for one of our webinars yet. So as I mentioned, I'm going to put my email address as well as our web address into the chat box. I highly encourage you, if you have participated and you're not sure about your status, feel free to email me. Or if you want to know more about what the study is looking at or how to get involved, please contact me.
Thank you so much, Whit. And you do have a comment in the Q&A about follow-up with this study. Really quickly, I'm going to turn it over to Matt Doran. He's going to tell us what you can expect at 3 o'clock on the
Hey, everyone.
CEP program.
Hey everyone, so in CB Community Live in a few minutes, we're going to be joined by Dr. Casey Vickers. She is part of our cognition team, and she's going to be talking about how to maximize your attention, some different strategies that we recommend here in the CP program. And so yeah, if you'd like any tips on attention, please come and join us in a few minutes. I'll post a link to register for our free event as well in our chat. Thanks, guys.
Thank you so much. All right, and Dr. Parker, so you didn't do a formal presentation this week, but tell them what they can expect from you and Dr. Hermida next week.
Well, next week, we're going to be very fortunate to meet with Dr. Adriana Hermida, who is one of our geriatric psychiatrists here. We will be offering for people who have family members who are living with dementia and have behavioral problems and disturbances in their wandering, their sleeping, and things we've talked about a couple of weeks ago. She's going to tell you about a new service a new study, but it becomes a service that we're going to be resuming at Wesley Woods Hospital as an inpatient. So Dr. Adriana Hermida from the Department of Psychiatry is going to come talk to us next week about dementing behaviors and a special study and behavioral assessment that will be available to people, next week. So please tune in.
All right. Okay, guys, we wrapped it up. I will leave the chat open for a while so that you can grab all those important links and email addresses and telephone numbers. Thank you guys for posting and commenting, and be on the lookout for the recording and the link for next week. Any closing remarks, Ms. Cynthia, Dr. Hepburn, Dr. Parker, before we aloha?
See you next week.
All right. Okay, guys, see you all next week. Have a great rest of the week. Goodbye.